I entitled this podcast Future Issues because the first thing I think about when I see you for a hair consultation is actually not your present problem, and it's not even your past problem, but is your future issue. I'm really looking at what is going to be the problem in 5, 10, 15, 20 years. I had a gentleman that came to me who was 27 years old that wanted an incredibly low hairline like a Norwood 1, which is a prepubescent hairline. And he said, I don't really care what I look like at 40. And at the time, I was 42, which is 10 years ago. And I was saying, sir, I care what I look like. And at the time for me, 50 years old seemed pretty old because I was 42. I'm now 52. 60 seems old. My mom, who's 80 years old, thinks 80 is really young. So the definition of old is a very simple term. It's just someone that's older than you are. And that number continues to change because the older you get, the younger everyone else seems, and you just, there's a relative change of things. So what's very important as a hair surgeon is when I see you, I think about the future issues. And during the consultation I have with you, I won't just talk about your past problems, what you're currently facing, what you want to have done. I'm also thinking, what do I have in my back pocket? And that means your donor hair for future sessions. What are the things that I could have a problem with in 5 or 10 years? And how can I avoid an issue? Now, the one thing that's true with a hair surgeon is that there is no such thing as 100% risk-free. There's no such thing as that you'll absolutely stop losing hair at all completely, and that I'm not going to worry about future hair loss. That's why medicine is so important. That's why judging the amount of donor capacity versus what you have, the degree of loss depends on the degree of miniaturization, how old you are. There's so many factors that go into my judgment for future safety. But the one of the biggest things that I think make me different from a lot of hair facilities where they're just there to make a dollar off you is I counsel you very aggressively. Sometimes I lose cases because patients get scared. And I said, you know what, it's fine. I'd rather scare you away than just operate on anyone that walks through the door. I actually turn away a huge percentage of my patients. In fact, now, in order to minimize some of the demand issues I have, is I pre-screen a lot of my patients via photographs submitted to me to say, look, this guy's not a good candidate for a hair transplant. I don't think we should do a formal consultation. We can do something where my hair coordinator walks through the basics of what you need to do to prevent further hair loss and medical therapy. And I just manage a lot more of the surgical consultations. So a large component is really thinking about future hair loss. You do not have the capacity as a layperson to understand what's safe and what's not safe, relative degrees of risk, relative degrees of safety. But it's so important not to focus on your current problem alone, but think about it in integrated fashion with future issues.